In this section, we will discuss the 3 steps to complying with the NIH Public Access Policy. They are addressing copyright, submitting the paper, and citing the article. The first step is to address copyright during the publication process. You should make sure the journal knows that the paper is NIH funded and needs to comply with the NIH Public Access Policy. The publishing or copyright agreement should be reviewed to ensure that the publisher will allow the article to be deposited in PMC. So far, the NIH has not run across any journals that do not allow compliance with the public access policy. You should also find out who will submit the article. Some journals will do this for you, which version can be submitted, and when an article can be made publicly available. This is referred to as the embargo period. Journals can request that their articles be held for up to 12 months before they are made publicly available. If you request an embargo, the article will still be in PMC, but the full text will be hidden from view until the embargo period passes. The next step is to submit the paper. Again, you will want to find out from the journal which submission method to use. There are 4 different submission methods, A, B, C, and D, which we will talk about in detail. In some cases, the journal may do all of the work, some of the work, or none of the work, so find out up front what you will need to do. Reminder: you need to submit the articles upon acceptance for publication in order to ensure that all submission tasks are completed within 3 months of publication. In submission method A, the journal will do all of the work for you. The journal will submit their formatted version of the article directly to PMC. If you are lucky enough to be publishing in a Method A journal, all the PI or author needs to do is to make sure that the journal submits the article and follow up and make sure the PMC ID gets assigned. It is always the PI's responsibility to comply with the policy, so even if the journal says they will do the submission, if they do not submit or are late, it is the PI who will be held accountable for noncompliance. A list of Method A journals is available online, and fortunately, the number of journals offering Method A submission is constantly increasing. Method B is the same as Method A, except the author must ask the journal to submit a specific article. However, the journal will usually charge a very large fee for this service, anywhere from $1,000 to $3,000. The submission tasks are not that difficult, and you always have the option to do the submission yourself. You never have to pay to get your articles into compliance with the public access policy. If you do use Method B, the PI or author will need to request that the journal submit the article, pay the fee, and then follow up and make sure a PMC ID gets assigned. A list of Method B publishers is also available online. In Method C, the author or PI must complete the entire submission process, which involves 3 tasks. The author or PI is responsible for each of these tasks: submitting the files, approving the PDF receipt for processing, and approving the manuscript formatting for PMC. The file submission can be performed by a delegate, such as a research administrator, assistant, or graduate student. The author will need to do the 2 approval steps. Once all of the submission tasks are complete, the PMC ID should be emailed to all of the authors on the paper. You will want to make sure this gets assigned within the required 3 months from publication. Method D is very similar to Method C, except the publisher does the first task and submits the article through the NIMS system. The author or PI is responsible for making sure the journal knows to submit the article. The publisher will list the corresponding author as the contact for the 2 approval steps. That person will be notified to approve the PDF receipt for processing and to approve the manuscript formatting. If there are multiple authors on the paper, you will need to decide who is going to take responsibility for these tasks in advance and make sure that person is listed as the corresponding author. After all the submission steps are complete, watch your email to make sure the PMC ID gets assigned. A list of Method D publishers is also available online. Now we'll go into more detail about those 3 submission tasks, which again only apply to submission methods C and D. All of the tasks are done in the NIH Manuscript Submission System, or NIMS. The first task is to deposit all the files, the final peer-reviewed manuscript, any tables, figures, or images, in the NIMS system. In Method C, the author or delegate does this, and in Method D, the publisher does this step. If you are doing the submission yourself, you will need to use your own copy of the article. Remember, you cannot download the PDF version from the publisher's website and submit that. Do the submission as soon as possible so files are not lost. Task 2 is to approve the PDF receipt, which will list all of the information that was submitted about the article and all files that were submitted, and ask the author to confirm those details are correct. There's also a brief statement regarding the intellectual property of the article, which is why the author needs to do this step. It will also ask the author to set the embargo period if one applies. Task 3 will follow a little later. The author will receive an email asking them to log into the NIMS system to review and approve the formatting of the web version of the manuscript that will be displayed in PMC. The author can request manuscript corrections at this point if needed. After the third task is complete, the PI and all authors should receive an email with the article citation and PMC ID number. If an embargo was specified, the article will automatically be made available in PMC when the specified time period expires. Before you submit your paper yourself in the NIMS system, you will need to have the following information: an ERA Commons or MyNCBI username and password, the journal name, the manuscript title, all grant numbers, all of the manuscript files, and you will need to know the embargo period required by the journal, if any. This is a screenshot of the login screen for the NIMS system. You can use an ERA Commons or a MyNCBI username and password to sign in. Whichever method you choose to use, you should always log in the same way. If you log in different ways, you will not be able to see all of your information. On the HSL guide about the NIH Public Access Policy, you can navigate to the NIMS System tab for step-by-step instructions and tutorials on submitting papers in the NIMS system. If you have articles that are showing as non-compliant, you will need to take steps to bring them into compliance as soon as possible. This is known as retrospective submission. The first step is to contact the journal and ask for permission to submit the manuscript to PMC. Also, you will need to find out the embargo period that the journal requires. If it has already been more than a year since the article was published, the embargo no longer applies. You will also want to review your copyright agreement with the journal to make sure you can submit the manuscript to PMC. Determine who will take responsibility for submission. If there are multiple authors on the paper, only one needs to do the submission. In the interest of time, you may want to use Method C to submit the manuscript, even if the journal offers to do it for you. In that case, you will then need to submit the manuscript yourself using the NIMS system. The final step in the compliance process is to cite articles. For all NIH grant applications, renewals, and progress reports, you must cite the PMC ID for all publications subject to the NIH Public Access Policy. This includes papers authored by the PI or that arose from their award. So, even if the PI is not an author on the paper, it still must comply with the policy and be cited if it was a result of the PI's NIH funding. In some cases, it may be appropriate to use a substitute for the PMC ID. This slide shows a timeline for citing publications. If the publication is in press or less than 3 months have passed from publication and you need to cite a paper on a progress report, you can use the PMC ID if you have it. If you do not have a PMC ID, for methods A and B, you can use the phrase PMC Journal in Process. The NIH knows which journals submit articles directly to them and will know to expect the submission directly from the journal. If you are using submission methods C and D, you can use the NIH Manuscript Submission System Identification Number, or the NIMS ID, which gets assigned when you submit your articles through the NIMS system. However, the NIMS ID is only a temporary substitute for the PMC ID and should only be used when you need to cite a paper soon after publication and the PMC ID is not yet available. After 3 months have passed from publication, you should have a PMC ID and you must use that PMC ID to show compliance. The NIH will not accept the NIMS ID after 3 months. If you submit your paper as soon as you're accepted for publication, you should have no problem completing all of the submission tasks within 3 months. There are several ways to find the PMC ID. If the article was submitted through NIMS, it will be emailed to the PI and all authors once it has been assigned. It is also available in the My Bibliography section of MyNCBI, which we will talk about in the next section. Those are probably the easiest ways to find the PMC ID. You can also look it up in PubMed or in PubMed Central. Or if you have the PubMed IDs or PMIDs, you can use the PMID to PMC ID converter tool to find the numbers. We also have a sample citation here showing you that the PMC ID goes at the end of the citation. Finally, this is a screenshot of the abstract view of an article in PubMed. The PMCID is at the bottom, circled in blue. If you are pulling PMCIDs from PubMed, just make sure you are copying the PMCID, not the PMID. For more information about the NIH Public Access Policy, visit the HSL's NIH Public Access Policy Guide or submit a question to the HSL using our Ask a Librarian service.